Much, Georges, and now we move to Toby Cosgrove.
Well, thank you very much, Michael, and I would say it's a privilege to be here. First of all, I'd like to congratulate the authors and the organizers of this. This is a tremendous piece of work that I think it has brought together a number of factors which are vital to our healthcare delivery system. We've heard a lot today about value, and I am thrilled that the emphasis of this particular paper was about value. But one of the determinants of value is cost, and we've heard a lot about cost, not only the $3.2 trillion that we spend on healthcare every year. Perhaps unspoken in this is right now, last year, 52% of the hospitals in the United States lost money on operations. So this puts us in stark relief about the importance of cost of our healthcare delivery system. And clearly, we're not going to be able to address this without major changes as we go forward. One of the things that I'd like to point out is that we've heard a lot about the environment and behavior and its importance on both survival and the quality of health. Right now, interestingly, healthcare delivery systems across the United States will be called on for their responsibility about these factors for which we are A, untrained, and B, not funded for. And I think it's important to recognize that and begin to figure out how we change that. I think telehealth has an enormous opportunity to change how we deliver care, how we make care more efficient, and how, and how we cut down on the cost of care. This is going to require significant legislation, which allows us to practice across states. Right now, in order to read an X-ray in Cleveland, we have to make sure that every radiologist is recognized in 50 different states in order to be competent to do that. I would point out the tremendous burden that right now we have in terms of quality metrics. We report 145 quality metrics to the federal government on an annual basis. And in the last 2 years, there have been 14,000 pages of regulations that have come to us around the ACA. Fascinating reading. I'm just beginning to finish those. I would point out that what has already been emphasized is the importance of a team-based medical delivery system. This really starts in one's training. None of us were selected to be because we were team players, nor trained to be team players as we became physicians. We have taken a major step, I think, that will begin to change that. We now have a new medical school building that will bring together doctors, nurses, physicians, assistants, and dentists all together to begin to have teach team play right from the beginning, which is currently not part of what we do. Big data represents a challenge, and it also represents an enormous opportunity. The total amount of knowledge in healthcare is now doubling every 73 days. And when the human genome, with its 3 billion pieces of information, begins to be increasingly important in clinical care, this provides a tremendous opportunity and also a tremendous challenge for us as we go forward. And I think that AI and IT are both going to be vital, both for our training doctors and getting them trained to manage this, and also dependent upon the people on my right to be able to help us through this segment. I would point out that the importance of research. And research in the past has been just as segmented as has the cottage industry of hospitals. And I think it is time now to make federally granted and grants dependent upon whether one actually releases that information on a regular basis to get away from the duplication of services and the duplication of effort that's taking place in laboratories across the country. I think this will speed up the progress in research, and it'll also decrease and make it more efficient and decrease the cost of that. I think the financial implications of these factors and many others are important to us as we are going to put more and more emphasis on value. We have to decrease the cost. Perhaps the most important portion of a political discussion is not where we proportion the money and who we give it to, but the fact that we decrease how much it costs to provide the care and keep a healthy nation.
Thank you very much, Toby. You mentioned